Hello and welcome to Pregnancy Info. Today we will discuss almost 18 causes of shorter or lighter periods. There are many reasons or causes of this problem, but the question is this cause for concern? Everyone's menstruational cycle is different. A period can last anywhere from 3 to 7 days. But you know your body best. A normal period is whatever is typical for you. If your periods usually last 5 or 6 days and now only 2 days, it may be because of a change in schedule, a new birth control, or even stress. Here are 18 causes of these shorter periods or lighter periods. It can be age-related. It's normal for your menstruational cycle to change at different times in your life. For example, at the stage of puberty, during puberty, your hormone levels begin to fluctuate on a monthly cycle. It takes a few years for those hormones to develop a regular schedule. In the meantime, they can be irregular, leading to shorter or longer periods. Other menstrual symptoms common during puberty include irregular periods, light or heavy bleeding, missed periods, 2 periods per month. Another cause is perimenopause. Perimenopause is the time leading up to your final period. During this time, your hormone produce decreases and periods typically become irregular. Your periods may be shorter or longer than usual. You may also experience mixed periods, light or heavy bleeding, irregular periods, fewer periods per year. It could be due to lifestyle changes also. Changes in your daily routine can impact your hormone levels and can cause irregular periods. Stress. Stress takes a toll on your whole body, including your ability to produce hormones. When your hormone levels are affected by stress, it isn't uncommon for your period to become irregular. This may include less days spent bleeding. Other symptoms of stress include anxiety, fatigue, insomnia, weight loss. Excessive exercise or athletic activities. When you exercise excessively, it's easy to burn more calories than you eat. If this goes on for weeks or months, your body will enter starvation mode. Your body will begin to use all of its remaining fuel or calories to perform critical functions like keeping your heart beating at the expense of other functions like producing reproductive hormones. When your hormone levels decrease, it can cause irregular or missed periods. Excessive physical activities can also cause mood swings, tiring more easily, getting sick more often, unintentional weight loss. Significant weight changes. Any significant changes in weight can disturb your normal hormone levels. Following gastric bypass surgery and extreme dieting, many women experience irregular periods. Excess body fat can also affect estrogen levels, which means obesity can impact your menstrual cycle. Other side effects of major weight changes include headaches, fatigue, and missed periods. Eating disorders. Eating disorders that involve extreme calorie restrictions can affect the body's ability to produce reproductive hormones. A very low body fat percentage can also disturb normal hormone levels. This can cause irregular, short, or missed periods. Other symptoms of eating disorder include extreme thinness, low self-esteem, disturbed body image. Now, another cause is that it could be due to medications. Many common medications can affect your hormone levels and change your menstrual cycle, and so your periods can be lighter or shorter. Hormonal birth control. Hormonal birth control methods contain hormones that directly affect when and how you ovulate. When you start birth control for the first time or switch to a different kind, it's normal to experience some changes to your menstrual cycle. You may experience shorter periods or irregular periods for a few months until your body gets used to the new medications. Other side effects commonly seen with the pills are cramping, spotting, and headache. Other medications. Certain prescription medications can interfere with your body's hormones and cause irregular periods. Medications that cause irregular periods include those for thyroid disease, anxiety, epilepsy, and inflammation. Some more causes are the ectopic pregnancy. An ectopic pregnancy happens when a fertilized egg implants itself in an area of the body other than the uterus. Ectopic pregnancies often cause vaginal bleeding that may be mistaken for a period. Other signs of an ectopic pregnancy include abdominal pain, dizziness, and shoulder pain. Implantation. Implantation is when a fertilized egg embeds itself in the wall of your uterus. It occurs about 1 to 2 weeks after inception. In some cases, it can cause minor vaginal bleeding that may be mistaken for a short period. Implantation often occurs before you miss a period and develop other symptoms of pregnancy. Miscarriage. A miscarriage is an event that results in the loss of embryonic tissue or a fetus during pregnancy. Miscarriages often take place before women know that they are pregnant, which is why they are often mistaken for periods. A short, unexpected period could be a miscarriage. Other symptoms of miscarriage include spotting or bleeding, passing fluid or tissues from the vagina, abdominal pain. Pregnancy. Periods stop during pregnancy, but it doesn't unusual for there to be a spotting or light bleeding in the first trimester of pregnancy. Up to 1 in 4 women experience some bleeding during pregnancy. Other symptoms of pregnancy include sore or swollen breasts, nausea, vomiting, missed periods, cramping, or aversion of foods or smells. Breastfeeding. The hormone that helps you to produce breast milk, prolactin, also stops you from ovulation. If you are breastfeeding day and night, your period may not return for several months after giving birth. When your period does return, it may be irregular or shorter or longer than usual. When breastfeeding, you may also experience missed periods, months between periods, changes in period duration, light bleeding, or spotting at first. Ovarian cyst. An ovarian cyst is a fluid-filled sac inside the ovary. While these cysts aren't cancerous, they can sometimes be painful or cause bleeding. A bleeding cyst may be mistaken for a short period. Most ovarian cysts have no symptoms, but they can sometimes cause abdominal pain, particularly if they are large or if they rupture. Polycystic ovarian syndromes, or PCOS. PCOS can cause your body to produce more male sex hormones than normal. This hormonal imbalance often causes irregular periods, missed periods, or short periods. Other symptoms of PCOS include unwanted or excessive facial hair, acne, deeper voice, difficulty getting pregnant. Thyroid disorder. Thyroid disorders cause the body to produce too much or too little thyroid hormone. Thyroid disease infects about 1 in 8 women. Thyroid hormone plays an important role in your menstrual cycle and can cause a variety of menstruation irregularities, including short periods. Symptoms of thyroid disorders vary depending on which type you may have, but may include weight loss or gain, trouble sleeping or sleepiness, fast heart rate or slow heart rate, lighter or heavier than normal periods. In rare cases, it could be due to something more serious. These problems can be premature ovarian failure, POF. When you go into early menopause, POF is rare, affecting only 1 in 1,000 women under the age of 29 and 1 in 100 women between ages 30 and 39. If your ovaries fail, it means you no longer produce the necessary hormones to become pregnant. Your periods may become irregular and then stop entirely. POF can also cause hot flashes, missed periods, irregular periods, and vaginal dryness. Asherman syndrome. Asherman syndrome is a rare condition in which a scar tissue develops in the uterus. This typically presents after a surgical procedure. Uterine scar tissues may block the flow of your period, causing irregular or missed periods. Other symptoms include missed periods, difficult conceiving, miscarriages, cramping without bleeding. Cervical stenosis. It is the abnormal narrowing of the cervix, which is very rare. It typically happens as a complication of surgery. When the cervix narrows, your menstrual flow is obstructed. It may cause missed periods or abdominal pain. Sheehan's syndrome. It is a complication of childbirth that occurs when a woman loses large amount of blood or experiences low blood pressure. It's very rare in advanced countries where people have access to medical treatments. Sheehan's syndrome interferes with the body's ability to produce Pituitary hormones. Low hormonal levels lead to absent or infrequent periods. Other symptoms include difficulty breastfeeding, difficulty regrowing shaved pubic hair, low blood pressure, weight gain, and fatigue. Now, finally, the question is that when to see your doctor. If you are pregnant or suspect you could be pregnant, you should seek emergency medical treatment if you have an unusual bleeding. Otherwise, you can typically wait 2 or 3 months before seeing your doctor. This will allow your menstrual cycle time to reset and return to normal. Consider tracking your periods during this time. Make sure you note your period start and stop dates along with details about when bleeding is heavy or light. Your doctor can use this information to help make a diagnosis. I hope I have explained all the 18 causes in detail. So, if you like the video and find it useful, then like it, share it, and also subscribe my channel. Thank you.